morning everyone, I am Jana Lacto Sumagila, a student of Jose Rizal Memorial State University, Tampilisan Campus, taking up Bachelor of Secondary Education major in English. For today's, I will be presenting to you the chosen topic that I have, which is preventing teenage pregnancy and abortion. Today we will tackle about preventing teenage pregnancy. We all know that this problem is a worldwide issue. What comes to our mind when we hear the word teenage pregnancy and abortion? What is teenage pregnancy and what is abortion? Teenage pregnancy is a pregnancy in a woman 19 years of age or younger. It is all about a young woman who gets involved in sexual activity and gets pregnant in a young age. The common factor of teenage pregnancy are poverty, gender inequalities, gender-based violence, substance use, poor access to contraceptives and issues with termination of pregnancy, curiosity of experimentation, peer pressure, family-related problems, lack of information, the influence of liberal views on sex, social deprivation, lower socioeconomic group, low educational achievement, having had teenage parents, being in the care of social services, poor transition from school to work at 16 years of age, sexual abuse, mental health problems, and crime. Abortion is a procedure to end a pregnancy, also known as a termination of pregnancy. Abortion is all about taking the fetus away from the womb of a mother or a young woman who gets pregnant by taking some medicine. Abortion happens when a young woman gets pregnant but not yet ready to take the responsibility. It is known that girls who become pregnant as a teenager will face increased medical risk. And if the pregnancy is taken to term, there are also increased medical risk for their babies. We also know that teenage mother and their children can suffer from poorer life outcomes. How to prevent teenage pregnancy? There are many methods available to help prevent pregnancy, including IUDs, birth control pills, and condoms. There are also 3 things that we need to consider in order to prevent teenage pregnancy. First is knowledge. If we are aware of all the things that we do, we can't be inside a situation like being pregnant in the wrong time. And because it was the wrong time, then you only have to choose 2 options, whether to give birth of the child and live in a hard life, or abort the baby and continue your schooling. Second is birth control. If you really want to engage in sexual activity, then at least you must have use and contraceptives in order not to get pregnant. Number 3, self-protection. We as a woman, we need to know how to protect ourselves because, as we all know, some other teens got pregnant because of sexual abuse, like rape. Teens should also undergo counseling in order to lighten their mind about what are the negative effects that might happen if they would get involved in sexual activity in a young age without having some proper knowledge about contraceptives. Although there are many ways to prevent teenage girls from becoming pregnant, the only one thing that is absolutely effective is sexual abstinence. In simplest form, abstinence is a decision not to have sexual intercourse. But in order to attain this one must have self-discipline.